Hi, I'm Kolby, an instructor with St. John Ambulance, Alberta. One of the things we're going to look at today is how to use an AED, or an Automated External Defibrillator, along with CPR to be able to help a casualty that's collapsed with sudden cardiac arrest. CPR is one step, but using an AED, especially within the first 3 to 5 minutes of a collapse, can increase a casualty's survival rate anywhere from 41 to 74%. Now, CPR is your first step, but if possible, you want to try and get an AED, or an Automated External Defibrillator. Now that we have what's called the Public Access Defibrillation System, or the PAD system, and you'll see this in malls, in shopping centers around the province, skating rinks, bingo halls, golf courses, casinos. These are some of the areas where you will see the sign on the outside door, and then you might see a defibrillator placed on the wall inside. Now that's there for public to have access to use in a case where you're doing CPR on a casualty. It's kind of the next step to be able to increase the survival rate of a person. So as soon as somebody starts to call for 911 and they start doing CPR, they have an unconscious person, if possible, we want to try and get an AED on the scene as soon as we can. So I've been performing CPR and someone has come along and brought me an AED. Now, as a first aider, one of the most important things you need to remember to do with an AED is make sure your pads are placed on the chest properly. If the pads are not in the right spots, you're not going to get a proper current passing through the heart. So the first pad I'm going to put on the upper right portion of the chest cavity from the armpit line and above, and we need to make sure we're on bare skin here. The second pad is going to be placed just at the bottom of the rib cage on the lower left portion of the chest. And again, tracing a line from the pads, the heart should be right placed in between. Now, once the pads are in place, we just simply need to turn the machine on and listen to the instructions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient.
I'm clear, you're clear, everyone clear?
Shock advised. Charging. Stay clear of patient.
Okay. So getting ready to shock, everyone clear?
Deliver
I'm clear.
Shock now. Press the orange button now. Shock delivered.
So once the AED is delivered a shock, you want to go right back into doing your compressions and ventilations with CPR. Now, whether the machine delivers a shock or not, whether it says shock advised and you press the button, or it says no shock advised, going immediately into CPR is your next step. In this case, it delivered a shock. I'm going to start my CPR again. Both breaths in, and I'm going to continue with my 30 compressions. Now I'm going to keep doing this cycle, compressions and ventilations, for about 2 minutes or about 5 rounds. Once the machine has delivered a shock, it actually internally counts down that 2 minutes to allow CPR to make sure the blood is moving through the casualty. So after 2 minutes, the machine's going to give an audible signal to tell you to stop CPR so that it can reanalyze the casualty. Now you're just going to continue this process, allowing the machine to analyze and CPR until emergency medical help comes along and takes over from you. Remember, in an emergency, it's people like you that can do the greatest amount of good when you first come along a casualty. What we've just seen is a small piece of what you would find in a CPR course. To learn more, visit our website today.